I offer my prayerful salutations at the divine lotus feet of our beloved Master, Bhagavan Sri Sathya Sai Baba. I've been asking some of them how was the conference going on. They're saying the Hira Center is beautiful and it is very, very nice auditorium. I see that effect because it's very cozy and nicely air-conditioned place, and especially post-lunch, it is quite very nice here. And to come and deliver a speech at the fag end of a conference is quite challenging because what I saw yesterday as the inauguration, I think we are 50% of it, sir. Maybe we are almost 50% of it. So I hope all are awake. Yeah? In 2011, after Mahasamadhi, there was a very senior devotee and also office bearer came to me, and we were just talking in that. He said, Rathnakar, soon we may have to start charging in our hospitals. I don't think we can continue this. It sort of disturbed me when he said that, and I went home and was thinking maybe they're all very experienced people, and maybe the experience tells him that we may have to do this. In that situation, it looked like that. But I went home and sat alone and just prayed to Swami. Swami, you have given us this responsibility, but it's quite unnerving to hear such things. And quietly I prayed, whatever your will, that will be done. And today, after 15 years, still we are going very strong and we don't have to charge anybody. Now I realize very much that it is not we are running these institutions. It is Bhagavan himself who is running even the institutions even now. That is what all of us have to remember. And I have no doubt, and with full faith I can tell it will continue, and it will continue this way forever and ever. That much I am very sure. Though it looks little daunting at times when we sit on the table and see the numbers. When we were approving the budgets in the 12, 11, 12, 13 area, what the medical units of Sathya Sai Central Trust is to cost us, or what is the budget for per year budget. Now we are in 25. It's almost 3 times it is now. From last, it's not, it's reached to that level where it is double, and then we see now it is almost 3 times of what we used to do in the 2012 and 13. But somewhere we're very confident that this work will continue unhindered. This work which Swami started way back in 1954 when he laid foundation for General Hospital in Prashanti Nilayam. This will continue because this is willed by none other than Avatar himself. And all the resources unknowingly it keeps coming, keeps happening. Though we are sometimes look that we are up to the wall, but Swami creates a magic. Swami creates and he pats our back and say, don't worry, I am with you, and it keeps going. Only thing is we need to have that firm faith in Swami. Having such wonderful edifices of our temples of healing, which Baba created, which Swami created. I was just maybe in the 1991. I was in the college. 90 time Swami was, of course, now today I'm in the trust, and but that time I was only a student, and I had the opportunity to stand in the somewhere on the corners of the room and listen to the conversations. So one of the conversations when the people came, I think hospital, Prashanti Gram Hospital, super specialty at Prashanti was being planned, and people from England came here. Some of the people who were designing it, a company which designed Buckingham Palace, that is the same company which designed our Prashanti Gram Hospital also. So some foreigners, some very senior devotees, doctors who were with Swami. So one thing, when I was coming in the car, I was just thinking, what do I tell them? Then I just remembered this conversation. The height of the ceiling was around 24 feet in that hospital. Swami said no. They were saying it will give a lot of ventilation and a lot of air, and it will be. But Swami said no. You are seeing only that way, but here, who will the clean up if cobwebs are come in that height? It is very difficult. So Swami said, no, don't put that height and bring it down. It's very difficult in India. You may be doing something there, but immediately he cut down the height of. He said, no, don't do that. And I see so much of cost cutting has happened on that with that small decision, because otherwise our air conditions, our electricity bills would have been gone through the roof. But Swami was guiding everybody the way what it suits here, and many had been there as a boy standing for even giving cup of tea or giving some snacks. But I used to see all these conversations used to happen, and every day, morning, evening, Swami used to be completely engrossed into this, and all the time till, because he had given a word to the public in birthday 1990. In a birthday speech, he said, November 22nd next year we will be having the first operation. And if Dr. Safai were to be here, he would recollect what happened on the previous day or the previous to that day. There was nothing there, and the whole place was full of. Still, the flooring was going on. The cement was over, and the entrance to the big dome which we see in it was completely still. Scaffoldings were there and things like that. But it's not in the nature of the avatar to fail. When avatar gives a word, it happens, and entire nature works to fulfill that particular word. That is how 22nd November, Swami came there, and the surgeries, 4 surgeries was performed in that beautiful hospital as per his direction. Whatever he said, it happened on that day. Of course, Prime Minister and whoever has come, and that's everybody knows about it. But when he said something, it happened. So today, when he said, I'm going to give free medical care, health care, it will happen, and it will continue to happen. That firm conviction with which we should go. Now, so many doctors have come, and the last 2 days you have deliberated. We, as a institution, we need a lot of support, because we run these hospitals, and a lot of people come here with great hope. A lot of patients who are poor and needy, they all come here from distant places, hoping that they will get some good health care with no cost. Whenever I have a talk with our doctors and directors in Prashanti Gram. Normally, conversation happens that whenever there's a West Bengal train comes, there's lots of people who come and alight here in Prashanti station. So is the case with Orissa. Many places, many distant places. Sathya Sai Hospital, Puttaparthi is known as a heart hospital. Actually, people think, people say, of course, we have so many other specialties, but everybody refers to the heart hospital. And with so much hope, people come here, and we need hands. And being a not so urban area here, we find it, our directors find it difficult to get doctors in some specialties. We do get people, but many time when a replacement comes, it's quite hard. I think with such a conference, I think I request all the directors here and whoever is working with you, form a team. I think you need to form some teams here, experts from outside, specialists from outside and inside, whatever. We need to keep a dialogue with doctors outside the world so that wherever it is possible, they can chip in and they can come. Because it's not, I'm saying that I'm not using this platform to say you all come and help us, but definitely I want to say that because when you come here, you're also having a blessing of doing some good work. All of you in doctors, before you're joining MBBS, many of you had aspirations. You will become doctors, you will do a lot of service. Somewhere after a while, the focus gets little blurred, and because the environment is like that, the ecosystem is like that. Once you, all those aspirations, every student who wants to become an IAS officer thinks he can change the country, he can serve the country, but when he comes into that, the system doesn't allow that so easily. So similarly, especially when it has become a business and a very profit-making business, and because if you see top billionaires in the world, maybe 50% are pharmaceutical giants, pharmaceutical people who have promoted pharmaceutical companies. 50% of the top 20 or top 50, if you take, majority of them will be exactly, if you take your top 10 billionaires, they will be 50% of them will be pharmaceutical people. So that means they're selling medicines, basically. So that's the profit which sees in this line, but we also, that is recognizing that fact only, Swami started these hospitals to show as a beacons of hope to the people who are really have no choice. If they are having an ailment, they have no choice. If there's no help or no supporting hand, they will perish. In such situations, Swami created these beautiful hospitals. And I don't need to hesitate to say all of you should come and support this. It's a process. All of you also will find some enlightenment in itself. Swami created service organizations not just to come as a NGOs to come and do some service like Red Cross or any other Blue Cross, whatever you call them. But Swami created this service organization so that it will only lead to self-enlightenment. This is always, an avatar comes here, they drive every act of theirs towards a spirituality and a spiritual upliftment of humanity. They don't do anything here which is very mundane and very, that anybody can do these works. Even whether it is education, he wanted people to be educated with values. Even if it's medicine, he wanted medicine to be delivered with love and selflessness. That is why Swami created all this. Every channel that the God's descents will use only to sort of nudge us towards that spiritual journey. So definitely all of you, when you participate here, will be going one step towards the divine path. Definitely we are one step closer to him. Wherever you are doing service, definitely. But coming to Prashanti and participating in the very mission which he has started with so much of love for people around, people all over the country. So kindly, I think all the directors and doctors who are here, HODs, kindly contact them, and you do come here and do participate in the Sai mission, healthcare mission, because this country has nearly 300 million people who can't afford 1 square meal a day. We call ourselves Annapurna, we call whatever you read in papers, but hard facts still remain there. We still have people who can't afford a square meal a day. Then where do they come to hospital? Where do they go and see a doctor? How do they reach out to a clinic or nursing home and they take a... First of all, he'll be worried about where he gets his meal next day. So where do you expect him to walk into any hospital? Even government hospital to reach it is difficult for some of them. Forget about corporate hospitals. So that is the dire need in this country, that there is so much gap, there is so much need there. And that is the exact space in which we are, Sathya Sai mission, medical mission is actually operating. We are in a very, very important, in the reversal, very niche field of service where it is very much required. People are looking for this. People are desperate for this kind of help, because more and more we see now slowly it is getting corporatized. Already it is done in a big way, but it's still further going. Now people are contemplating that everybody should be insured, and the insurance-driven medical system will be not very far up. Already it is there, but it will come through. Again, like if you are insured, then you will have health. You will be able to go to hospital. Otherwise, you may not be able to go to hospital. Maybe it will come. Maybe 10 years, 15 years down the lane, it may happen. So Sathya Sai healthcare mission is very important for this country, to showcase that there is somebody, there is an institution which works in this particular model, and it is successfully running. That is what we need to demonstrate, and I think Swami has done it, and it will continue. All that we need to do is do our bit, do participate in this. And unfortunately, somewhere we have allowed business people have gotten, not the doctors, business people have started hospitals and medical colleges, only businessmen are doing. And Dhanvantari is a god of medicine. Is a form of Lord Vishnu himself, is what his scriptures say. He came out when that his ocean was churned, the Samudra Manthan. So he came out, and that is what the scriptures say. But do you know also there is one, in his honor, in his maybe birthday or whatever signifies, there's one event we all celebrate just during Diwali. You know what is it? You know what is it? Dhanteras. Now, Dhanteras day, every day, Dhanteras, everybody is in jewelry shop. Why everybody should buy gold, it seems. That Dhanteras day, that is how they have psyched up everybody, and a completely a different narrative has been driven to this country, that Dhanteras is a day when everybody should go and ladies should buy at least 1 gram gold at least. That is how they have created a big buzz about this. He is a god of medicine. What does do with the jewelry shop? Means they used to say health is wealth. Now it is not so. It is reversal. Now wealth is become health. That is how we are driving it. And this is how wrong things have been reinforced into the nation itself. It is not for jewelry shop that we have to do Dhanteras. I hope Dhanteras should be celebrated in hospitals and medical colleges, not in jewelry shops and whatever shops they are. So, but this is how they say they depict, then Lakshmi is there and it's all that. But Dhanvantari is a god of medicine. They call it, those days there was no English medicine, they say Ayurveda, whatever it is, the medicine. All our ancient people, whether it is Charaka Samhita or Sushruta Samhita, whoever they are. Charaka was a general physician and Sushruta was a surgeon, I understand. So they were there, these things were there already. Our ancient people knew it, that there is a general medicine, there is a surgery. Surgery requires a different skill. Otherwise, just seeing and diagnosing and giving some medicine, general medicine was there. So these things it's not new to us. And if you read Ramayana, Mahabharata, so many places we keep hearing people bringing. That's how Hanuman ended up carrying this. We see only then Hanuman Chalisa, and now again it's a completely different line we take it. But when he's carrying that, why was he carrying it? Because they asked him to get some medicine, something from somewhere, medicinal herb. He could not locate it because he did not have the knowledge. So he said, let me bring the whole mountain itself. So he brought it, but finally somebody brought that medicine and gave it to Lakshmana, and he came out of coma. So you see anywhere, if you go into our ancient scriptures, so much is there. So much of it has been spoken. Even in Pandavas, one of them is a very big doctor. Yeah, among to Nakula Sahadeva, one of them is a very big doctor. When Karna was asked to remove his Kavach Kurundalas, that Kavacham, no, which was by birth he was given a shield. So Surya asked him to remove it. He gives it because he's a great giver. Then when it was attached to his body, he pulls it out and gives. It seems he was almost collapsing because it had torn his body and so much bleeding. So they go and seek from Pandava, one of them, Nakula or Sahadeva's help to come and heal. And he goes and tells Kunti, they are opposition camp. What do we do? He said, no, doctor should never say such things. Whoever it is there, if he's a patient, we need to look after them. That's how he goes and heals Karna. So these stories are there in our ancient scriptures. The doctors are there. Patients also were there. And so please use this great opportunity. And I think all our Dr. Sundaresh team and Gurumurthy is here, Dr. Gurumurthy, and all his team, both the teams, Anil and Dr. Anil is here. I think we should put our hands together for a wonderful work they have done to put together this conference. It is very important. It's a great job, and it's very timely. Now it's in the marking 100th birthday, but it's very much needed. Many of them were telling me we were lacking this for a long time, sir. We're very happy to see this after a long time. So, which means you are expected to do it maybe at regular intervals. Don't give that much gap, because I think medical conferences should happen because we have such a big medical mission here. Maybe every 2 years or every 3 years we should not have. I think we have given too much gap now. I think every alternatively we should have. Maybe every 2 years, 3 years, we need to have this. It's good to congregate. It can inspire. Even if 5 people are inspired, I think this conference will be successful. Definitely, just 5 people are inspired. That is good. That is what it is. We should need to look. And before I close, I just one day I went to Mandir, and Swami was about to come for darshan. He was there, and the people around him mentioned to me that Swami is having temperature. And tell him, sir. I said, oh, is that? So then, so he was about to come. Only when they told me he's running temperature, then it looked to me, then with that information, when I saw him, maybe it looked like there is some temperature. Otherwise, he's like so fresh, and you can't make out. So I went down on my knees and told him, Swami, He seems to be having fever. Then I held his hand like that. It was very warm. I said, Swami, why don't you take little rest? You can go little later. Because I was standing near the door. I was to open the door. And immediately what he said is really stuck and stuck so much in my heart, and it made so much of indelible imprint in my whole conscience. Swami said, devotees lekapothe నాకు ఇక్కడ ఏం పని ఉందిరా, like that he said. If there are no devotees, if I don't go and see them, what else I have? What work I have here? That is what he said. Then I said no. Then I opened the door. Actually, I unbolted and opened the door. Then he was going. He said, devotees untene దేవుడు, దేవుడికి devotees కావాలి. That is what he said. Only when devotees are required for God, and God also needs devotees, and devotees needs God, there is no way you can separate it. And like that, he was walked out. And he went normally, looked around. So why I'm saying is, without patience, no doctors are there. You have no existence. Poor people are falling sick for your existence. Always be ready, be very, very loving towards them. Serve them. Even God wanted to see his own devotees. He said, I don't have no other work otherwise. You have a duty towards every patient. Because of them, you have a profession. You always say practice, na? Medical practice. So you are allowed to practice. No other people can practice. They have to perform. Throughout you are practicing only. You are in a practice session only. So medical practice only. You are not. If we do in sports, you are only practice, then you have to come and perform on the ground. Practice only nets. So everywhere like that only. If you are a dancer, you have to practice behind and come and perform on the stage. But I don't know, all of you keep practicing. So please continue to practice and perform also and do well. And before I close, just don't get offended. Something which I had mentioned also, I just say something just to lighten the whole thing. I just read one joke about, okay, they were in the operation theater, a patient was taken. After 10-15 minutes, suddenly the relatives outside found this fellow running outside the theater. They caught him because he had still cannula was there, and he was in that theater dress, and they caught him. Where are you running? Your operation, how did you come out? He said, no, that nurse was saying, don't worry, everything will go well, and don't have to worry about anything. You will be, everything will go well. They said, that's normal. They will say like that. There's no issue at all. Why are you running? That's the way they will, comfort you. See, the problem is she was not telling me, she was telling the doctor. So, so when we become patients, we are all in your hands. So, Sundaresh is laughing. So, take good care of them. Give them all the love you can. When you are serving every patient, remember, you are serving the divine himself. With that feeling, kindly serve. See that patient is giving an opportunity. Your patient is enhancing your career. That patient is the one who is running your home. Means, I have no problems in telling, that's the fact. So please take good care of them. Swami wanted that only. Swami always said, when somebody comes to my hospital, they should not get like other hospitals where half kilometer you'll get tincture smell. That's why he created such beautiful edifices. When you enter, you should come and pray there. That's why he created that beautiful prayer halls. People have asked Swami, why you are, such huge domes are there, prayer halls are there, why you have done that? It's a waste of perhaps money, because when you come inside, what is required functionally, you need OPDs, you need theaters, you need consulting rooms, but why all this paraphernalia? Swami said, no. when a patient is given that kind of a feeling, half of his disease is cured when he feel comfortable. It's a mental stress creates further damage to the health. When he comes into the Sai hospitals, they feel assured, not only by doctors, but the very presence of Swami when it is invoked, they feel at ease, the person is comforted. And also many times when we can discharge people very quickly. Why our patients get discharged? Because there's no stress on their mind. Where to mortgage our jewelry for payment of a bill, where to go and get our insurance and whether he will pay, where to go and get a loan, where to go and put our mortgage the house. So many things happen outside. When we go into, we have seen in COVID times when patient was given one story, so many big hospitals, when they delivered dead bodies, they gave bill also of 30-40 lakhs. We have seen this kind of behavior. So coming to Prashant, coming to Sai Mission, Sai hospitals, that is a hope for people. It's a hope. It's a biggest hope for many people who can't afford anything. So we should not belie that hope. We should continue to serve to the best of our ability. And for that, because you have taken a vow, because once you have taken a medicine, that means unless you love people, you can't come into medicine. You have to love humanity to come into this field, this kind of this particular vertical. Unless you love people, you can't be treating them. So fill your hearts with that love. Swami wanted everybody to smile. He said, doctors should smile, not smile that, so it should not look like we are in a different kind of wards or different kind of hospitals. Unnecessarily, we should not smile and giggle and think, people should not feel that. But give a pleasant feeling. And Swami even is to demonstrate also some of the doctors, when they see, you will feel lane disease kuda vachesthundi akkadiki. So what some symptoms you will start developing when you see some doctors. So we need to be pleasant. We need to have, and Sai Mission is treating so many people who are in absolute dire need. So just to help, put your own hand, hand there, just extend your hand so that this lovely medical mission of Sai will continue. It will continue whether somewhere other people keep coming the way it is. I told you what happened 2011. Somebody told me, and 15 years we are gloriously growing, and also we have improved a lot of things in hospitals, and continuously they keep upgrading and they keep giving me bills after bills. And doctors have they're very persuasive about themselves and about their what they want, especially when they come and meet me and say this equipment is required. I sometimes recently also I had a little bit of discussion on this. We have all hospitals, but each one will be buying one model. I say, why you want to buy different models? You have buy only one model. It is same hospitals under trust. Why do you need? They say, no, sir, our doctors in different places have different requirements. But I say, okay, the doctors must be right. And even if it costs little more, I keep signing the checks for them. And we continue to sign the checks. Only you have to only deliver the health care. That is what is expected. And we want to continue this medical mission as long as humanity exists. This is what should be our motto. This is not a 100 meters dash. It is a relay race. We have to give the baton to somebody. Somebody should carry it. We are not eternal. None of us are eternal. So we need to prepare the next generation. Give the baton, let them also carry this, and then let them do it. This should continue. This is for humanity. Swami has created this for humanity. So let us work together, and whatever support from Sathya Sai Central Trust, we have never said no, and I don't think directors are watch for me. Whenever, am I right, sir? Can you raise your hands? Whenever I said, you always said yes, no, sir. That is because we want the best care to be given, and we know who are the stakeholders. For us, the stakeholders are the patients who come into the portals of Sai hospitals. When we think of them, nothing can we deny to the demands are asked of our directors. That's how we have treated the whole thing. Here, even a mobile hospital is done a great job and is doing a great job. In fact, some additions also we are doing for that. Dr. Narasimhan had asked me some. In fact, it so happened some very. He has a problem whenever he has to go to a village here, then he has to find some school or some building for them to set up all this. So we are overcoming that also. It so happened the health minister told me there is some beautiful equipment has come, and I said I can't come. You can send them here only to Puttaparthi so that my people can see. So we had seen and how Swami helps and Swami is doing. I think let it come. Let him himself explain when it happens. And next 2-3 months we are going to have that. So everything is improving and everything is going, and let all our health also should improve. And healthcare starts at home, not in hospitals. Please, that also you should the preventive health which we talk about. Healthcare starts now. Healthcare happens so not only in hospitals. No. It starts at home. Your hygiene, your sleeping habits. You need to teach our people. That is how Swami used to tell all our mobile hospital doctors, when you go into the villages, teach them about hygiene. Teach them about how to keep their hands clean when they partaking food, because they would work and they come just like that and they eat. So that's how the infections happen. So your kitchen is a place where you need to start your wellness. Your home is a place where you need to have a very neat surroundings. So these things we need to also please bring in, and also maybe with that may not go well, but bring in all others also. Whoever 1 or 2 people are there here, we have people who are into Ayurveda, who are people. Maybe you can also help make them part of us. Need not have a complete departments for that. That is a different line altogether. But if somebody wants to come here and do some work, we should help them and facilitate them. And I'm sure these 2 days is very, very fruitful, and definitely it will strengthen the Sai mission, Sai medical mission, definitely. And by Swami's grace, we'll go from strength to strength. And who knows what is in store. But definitely I see a bright future, and more and more service. Swami said, what is the reward for when I do service of Swami? You know what Swami said? He said, more service. So when Swami said, what do you don't do service and expect a reward? He said, reward for your service is more service. I'll give you more service. So that is an opportunity. It is not everybody gets to serve. So always remember the more service, that means Swami is blessing all of us. So remember that, and thank you for participation, and take good care of yourselves. And I think many of them are in a hurry to go back also, because tomorrow, Monday, they have to start again their hospitals. Have a safe journey, and thank you once again. And we expect that all of you keep coming back and participating in Swami's hospitals. Thank you, Sairam.
Thank you, sir, for recounting interesting interactions with Bhagwan, and for your inspiring and insightful words of wisdom with a dash of humor. I request Dr. Sundaresh, organizing chairman of the conference, to hand over a token of our love and gratitude to the managing trustee for all his support and encouragement in organizing this conference. Thank you so much, sir. To formally conclude this sacred gathering, I now invite Dr. Sundaresh, the organizing chairman of this conference,